Bismillahirrahmanirrahim. My name is Professor Hussain Kolachi, and today I am discussing my one of the award-winning research paper, which was published in Pakistan Pediatric Journal, a very premier and prestigious journal published from Pakistan, Lahore. The topic was Primary Health Care, a Sindh Village Experience. This was perhaps the pioneer paper in this part of the country where such research was conducted in the deep interior or rural area of Sindh. It was district Mirpur Khas and my own native village, Kandu Kolachi, where this study was conducted in 1986. The center where this was, it was a community open center, not a government center, but an NGO sector. So this was the background of this paper. And ultimately, after publishing this, the organization Pakistan Academy of Medical Sciences, basically based in Pakistan, but the founder was Dr. Khalid J. Aman, a eye surgeon, renowned eye surgeon based in USA. So at that time, the research was almost not heard, or it was less at the college level or MBBS level. So I graduated in 1983 from Liaquat Medical College, and at that time the status of that was college, and now it is called Liaquat University of Medical and Health Sciences in Hyderabad, Jamshoro. So the paper was sent in response of the call of award to researchers based in Pakistan. So I applied and sent the abstract of the published paper, and ultimately the committee decided and awarded me a research award called Junior Research Award, because at that time the young researchers were selected with the Pakistani background, having a research background. So ultimately, this was the background, and I was informed by a letter from Pakistan Academy of Medical Sciences. Luckily or unluckily, I searched on the Google, the Pakistan Medical Academy of Sciences is not reflected or is not mentioned. Sorry. But Pakistan Academy of Sciences is also mentioned. So perhaps they have changed this name. So ultimately, the ceremony was fixed in Aga Khan University, and the auditorium of the Aga Khan was full with doctors, senior doctors, and fellow of Pakistan Academy of Medical Sciences, the renowned people like Ruth Fau, expert in leprosy, Dr. Iftikhar Chaudhary, a physician from Lahore. He was principal of King Medical College. So I was also one of the recipient of this award, and Mr. Justice Qadiruddin Ahmad, Chief Justice of Sindh High Court and Governor of Sindh Province, was the chief guest. That was first exposure to a high-level gathering and auditorium with air condition and one of the finest chair seating arrangement, and people who were just present, they were also illuminating with the happiness and with the ceremony. So in the morning at about 9 a.m. the ceremony started, and I was also called before the award recitation or introduction of the researcher was also presented. I was lucky that one of the host or the guest of this program was Professor Dr. Colonel Najib, a pioneer and founding principal and a legendary personality who developed and founded the Liaquat Medical College, and still people are cherishing and paying a lot of tributes. So I was called on the stage. The stage was so charming and so shining, and the lighting was in a better way. The bouquets and other decoration pieces, and we were dressed in a dress, shalwar kameez, and wasket or achkan, and jana cap, black cap. I was at that time of 34 years, and when I am recording this, I am 67 years old. So, taking you back to my research, the research was basically on primary health care needs of the community who were coming for their minor illnesses, basic illnesses like fever, diarrhea, pain in the abdomen, injuries, so on and so forth. Children were not immunized. There were less immunization center. Awareness was not there. So the quakes and the hakims and all these people who are just treating qualified MBBS doctors were rare commodity at that time. The social media, the internet, even the telephone facility was a privilege. So ultimately, I received a gold medal, and when I saw Colonel Najib Khan, it was just giving me more happiness that I am seeing a principal who established in a war in a better footing, and one of the best college of Pakistan, which was recognized by the British Medical Council. I am showing you some pictures. This is the first picture where I am receiving the award or medal from Justice Kadiruddin Ahmad, and I am just in my Pakistani dress. Justice Kadiruddin is in the gown, and this was first time that I saw what is the degree awarding ceremony, because at that time college level we were not used to such convocations. The second picture is also the same. The third picture shows the entire faculty or fellows of Pakistan Academy of Medical Sciences. In the middle, if you can see the governor, and then Khalid Aman and Colonel Najib Khan are seen in the picture. This is another, and the names are also written. This I have taken from the Bulletin of Pakistan Academy of Medical Sciences, because I used my camera, but I was not experienced, and ultimately the reel or the photography could not materialize. So these are the pictures which I have captured and kept in my record. Uh, mm, yes, this is another view. You can see that this shows that Pakistan Academy of Medical Sciences, when it was given charter, uh, President Ghulam Ishaq Khan awarded the charter to this organization. And this was perhaps after this ceremony that a full charter was awarded. And this is the page of the bulletin where the award names of awardee are mentioned. My name is also mentioned here. Then coming to this, perhaps the last picture is from Jung and other newspapers. You can see that award and gold medal are given. In the last, I am standing and receiving. Then is the Dr. Ruth Fau. She is no more with us. So this was the scene where I was called and given honor. And this is another view of the gathering. You can see the monogram, the stage, and the people who are sitting, how they are listening. There was pin drop silence. So that was a great honor, being a rural doctor, only MBBS doctor. At that time, I had no post graduation. So this research was basically a study of 1,700 patients having different common diseases. Only nine drugs in which antibiotics, anti-malarial, anti-diarrheal, and antipyretic few drugs, and then you need only the bandages and some ointments, as well as the most of the problems were nutritional. Clean water supply was not there. Raw water was directly taken from the canal and the rivers. The sanitary conditions were that the latrine were not used in the villages at that time. So a lot of worms and other diseases were there. Immunization was not there. So you need only very few drugs, but you need more hygienic and nutritional and immunization services to carry on the primary health care in rural area. And this paper was also presented in the pediatric conference of Hyderabad, first of its kind. And the clean water was given importance over the ORS. That was the main finding, and only few drugs and the dedication and community mobilization was considered. So I think Dr. Hussein Bushkolachi has given you this information, shared this for the young doctors and the students of Liaquat Medical College and now University, ISRA University, and all over Pakistan. They can also go on the path where I reached and received such honors, and they can have a full-fledged career in primary health care and medical and public health research. So please, for updates and such rare and such historical information, you will like and share the Dr. Hussain Bashkolachi YouTube channel. Presently, I am working as a professor of community medicine and also uploading the videos on my Dr. Hussain Bashkolachi YouTube channel. Thank you very much for patient listening. Please do have your comments and observations, and like, share, and subscribe my channel. So this is the end of my presentation, and thank you very much.